Thanks so much for joining us for Healthline 3. I'm Wendy Redmond. Today we're chatting all about the flu, how big of a problem it is this year, and what's the best way to avoid getting it. Isn't that always the age-old question? Dr. Paul Bracey with Urgent Care joins us now. He's going to be answering all of your questions about the flu for the next half hour. So we really want to encourage you to ask all the questions on your mind. If you're online, just fill out the information on your screen and submit it. Or as always, give us a phone call. We love that too. The number is 318-219-4569. We'll be taking all of your questions until 12:30. First of all, doctor, how bad is the flu in Shreveport right now?
Well, for the up until about a couple of weeks ago, it really wasn't that prevalent, but we've really seen a big increase in the number of patients with flu over the past 2 weeks, and the CDC's data kind of backs that up. If you look at states that are reporting widespread flu, Louisiana is one of those states, and our experience in the clinic is that it's just skyrocketed. The CDC reports that when they check isolates for influenza-like illnesses, so patients who have an illness that symptomatically looks like the flu, about 2 weeks ago, only about 10% of the isolates were testing positive for flu. Over the past 2 weeks, 35 to 40% of those isolates have tested positive for flu. So you've seen a big upswing with influenza being the culprit for those illnesses.
Any reason, do we know why Louisiana might be so high in our numbers?
No, I don't think anybody really has nailed that epidemiology down yet, but we're one of 10 states that are reporting widespread influenza illness. Some other states are still reporting sporadic illness, but we're just one of the unlucky 10.
Okay,
right now.
So since we are so unlucky, it's even more important to know all the steps to take to make sure that you don't get it, your kids don't get it. Nobody wants to be sick. That's just a bummer for everybody. So, and it can be deadly. It can be more than that. We don't want to brush it off either for some people. So what are some steps people can take to protect themselves?
One of the big steps would be the flu vaccine. The flu vaccine is kind of the first step and probably the most important step in flu prevention. The vaccination program for all illnesses that we vaccinate against has been highly successful. We have very low rates of infection for nearly all of the illnesses for which we have vaccines. And the vaccine is the reason. So the flu vaccine, unfortunately, is an annual vaccine. There is no master flu vaccine because the flu virus does change. There are thousands, if not millions, of types of influenza virus. Those are constantly mutating, changing, and require us to constantly adapt and modify the flu vaccine. Although there are some common strains that occur in the vaccine for several years at a time. For instance, the flu that we're seeing right now is largely the pandemic H1N1 influenza from 2009. So we're still seeing that as kind of one of the major culprits right now. That is in the flu vaccine this year. It was in the flu vaccine last year, and as well as the year before that. So since 2009, they developed a single vaccine for H1N1, the pandemic H1N1, and in 2010, it became incorporated in the flu vaccine seasonally. So.
What about the people who say, every year you hear people say, I don't want to get the flu vaccine, I don't want to get sick, the vaccine will make me sick?
Well, there are some people that shouldn't take the flu vaccine. For instance, people who are allergic to eggs.
Why is that?
Because the flu vaccine uses eggs to incubate the virus, to culture the virus. So the egg proteins are present in the vaccine, and if you're allergic to eggs, and we're talking significant allergy, typically what we refer to as anaphylaxis, then you should not get the flu vaccine. The other people, the shot is killed viral particles. It's not a live virus. The flu mist is a live virus. So there's some people that should not get the live virus nasal spray. People without an intact immune system, most importantly. So there are some people that shouldn't get the flu vaccine, and it's important to know that. But for the majority of us, that's kind of the first step. Now, there are some people who have reservations against the vaccines, and that's understandable, and everyone has a different viewpoint on that. But it plays an important role. You cannot catch the flu from the vaccine. the vaccine is, like I said, kind of chopped up little pieces of virus. The goal for that is to present that to your immune system so that then you will develop antibodies and you'll be prepared. So you'll develop a line of defense against the flu before it even becomes a problem. So it takes about 2 weeks to develop those antibodies. So you want to get the flu shot or the flu vaccine, sometime prior to flu season. But even in the middle of flu season, it's not too late. Even if you've had the flu, it's not too late, because the flu virus vaccine, depending on which vaccine you use, can protect against 3 or 4 strains of influenza. And even if you got one of them, there's still the other ones that it can help protect for.
What one's better? Should you get the 3 or the 4?
Well, the 4 is the quadrivalent vaccine is relatively new. The trivalent vaccine is the one that's been around for decades. The quadrivalent vaccine has been around for a couple of years, and more manufacturers are developing the quadrivalent vaccine. It appears to be equally as safe and can protect against a 4th strain of influenza. So I think I took the trivalent because that's what we had available at the time. But either one will help prevent flu infection. The trivalent has been successful for decades, but the quadrivalent just adds another virus that it will help protect against.
Okay, we've got a caller on the line now. We have Jerry. You're on the air. What's your question?
Yes, sir. Yes, ma'am. I was diagnosed last Friday having the flu. I'd had it for about 4 days. They put me on, I think is it Tamiflu? Medicine?
Tamiflu, yes, sir.
Tamiflu. They put me on that, and this is my last day. I got one more pill to take of it. I'm still coughing. I've still got congestion in my head, and you feel feverish, but I don't know whether I've got fever or not. I'm wondering, I'm waiting till like Thursday to go back and see my doctor. I'm just wondering how long it's going to take for this medicine to kick in, or is it going to by now?
Well, Tamiflu is a little different than taking an antibiotic for, say, a sinus infection. You will probably finish the Tamiflu before you feel better. Tamiflu does not particularly go in and eradicate the infection. It kind of slows down the virus so that your immune system can do the job for you. So odds are, and I try to tell my patients that odds are that you will still have some symptoms beyond your course of Tamiflu. There are only 2 medicines that we have that will help fight influenza virus. One is, that we use currently. One is Tamiflu, and the other is Relenza. Those are the name brands. Tamiflu is a capsule or a liquid for children, and Relenza is an inhaled powder. So there's some limitations in the use of Relenza. But Tamiflu is the one that is most frequently used in this country. Unfortunately, the symptoms of the flu can last beyond the course of Tamiflu, but there is no benefit if you're otherwise healthy. There is no benefit in extending that course of Tamiflu beyond the 5-day, twice-a-day regimen. It doesn't really seem to give you any real benefit, and then you may run into some of the GI side effects associated with it, which is nausea and some diarrhea. So
if his symptoms persist, for how many more days before he should go back to the doctor? Generally,
with influenza, you expect the symptoms to last 10 to 14 days. Those who have good intact health system, immune systems will err more towards 10. Those with less, more towards 14. On occasion, especially with H1N1, you can see it persist even beyond that time frame. My daughter got H1N1 in 2009, and she ran a fever for 3 weeks straight.
Goodness.
And you control it with Tylenol and Motrin, but that was and children can prolong that illness a little bit longer sometimes than adults. But the things to look for, some of the complications of influenza would include pneumonia, ear infections, sinus infections. So if you develop other symptoms on top of the flu symptoms, which are miserable enough as it is, with the body aches, the fever, the congestion, but if you start developing shortness of breath, if you start having a worsening cough, if you start having chest discomfort, then these are symptoms of pneumonia, which can complicate the course of the flu, typically hit around day 7 or so, and can be fatal. Is a particularly difficult pneumonia to treat sometimes and manage, but vigilance and surveillance, looking for those symptoms, and staying in contact with your physician is a good idea. I mean, it's an excellent idea. We always tell our patients, if things are not going the way that we want them to, if things are not going the way we expect them to, we want to know. We want to follow up. We want to know so that we can attack it early.
Okay. Does that answer your question, Jerry?
Yes, ma'am. How long would I be contagious? How would I tell?
Well, that's a good question. And for influenza, generally you become contagious the day before you develop symptoms. So the flu has an incubation period of 1 to 4 days. You start to develop symptoms the day after you became contagious. So you started spreading virus before you even knew you had it. And then you're usually contagious for about 5 days. If you have a weak immune system for some reason or another, say you're on chemotherapy or you have an inherited disorder with your immune system, that can extend to about 7 days. But if you're a generally otherwise healthy person, usually 5 days into the illness is the time frame that you're contagious, and beyond that, typically not, though there can be a little bit of variation. How do you know absolutely if you're contagious? There really is no way to know if you're going to be a day 5er or you're going to be a day 7er. A lot of times we will, in other illnesses, use fever as the marker for kind of periods of contagiousness, but that doesn't always really go with influenza, but generally 5 to 7 days into the illness.
Oh, okay. Thank you. That's what I needed to know.
Well, you bet.
All
you
right.
bet. And I hope you get better soon.
Yeah,
Okay.
feel better,
Thank you,
Jerry.
sir. Bye-bye.
All right. If you have a question for the doctor, maybe you wonder if you have the flu, maybe what you should do, give us a call, 219-4569. We'll be taking all of your questions for about another 20 minutes. So how sick are people getting around here? How bad are the flu viruses that are going around?
It's kind of running the spectrum. We're seeing some people who are just minimally ill, who have what seems to be a cold, and all the way to people who are essentially laid up in bed with rigors and severe body aches, congestion, dry cough. So it's running the gamut. So some of that may be due to the fact that so many people are getting their flu shot this year. If you're getting your flu shot, you can still catch the flu, but it tends to provide you that, like I referred to, that line of defense with those antibodies. Now, the flu is such an aggressive virus, a lot of times it can breach that line of defense and still cause some symptoms. But having those preformed antibodies sitting there ready to attack that virus when it enters can help mitigate some of the symptoms that you get. Mm-hmm. But we're seeing the gamut. I was in one of the local hospitals yesterday, and they had a lot of influenza in the admitted patients and some people in the ICU. So it is a significant burden, health burden.
How does this year compare to previous years so far? Last
year, in our experience at least, and I think kind of nationally, was a relatively mild year. If you kind of plot the data of several years on top of each other, we're seem to be following the normal trend here in Louisiana, even though we're one of the 10 states. We seem to be following somewhat of a normal trend. I wouldn't say that this year is profoundly so far worse than prior years, but we are one of the unfortunate things is we're still seeing the pandemic H1N1, which tends to cause a lot of symptoms, a lot more serious kind of illness, and affects people's health a lot more. So probably on par.
Okay, so peak season, you were telling me earlier, is January and February. When is it over? When are we?
Well, usually
feel like
it extends into March and April. For now, warmer states for seasonal influenza tend to get a break earlier than colder states. So we may see an earlier relief than people up north. But generally, it starts to hit mid-December, end of December, January, February, peak months, and then it starts to kind of peter out, right before allergies hit. So, so that tends to be the general time frame for flu season. Now, H1N1 throws a wrench in that plan. H1N1 is presented as a warm weather flu. It crossed the border from Mexico in April to May of 2009, and persisted all summer long. You don't see that with seasonal influenza generally. But H1N1, the pandemic, really started in the warm weather months. So with H1N1, bets are a little off as far as when we will see it stop. Generally, the pandemic is not nearly as I'm even sure it's still considered a pandemic, H1N1, but the number of cases were nothing near what we were seeing during the onset of the pandemic. But and is treated much in the same way as every other influenza. So generally, for seasonal flu, you're talking about January, February, and then into March and a little bit into April. For us, for H1N1, you can see cases year long. So we came on in August for a segment on it as well, because we were seeing cases. We were seeing cases of H1N1 even in August. And
nothing's worse than 100-degree temperatures and dealing with the fever, right?
Right.
Miserable.
Right.
Well, how do you know the difference between a really bad cold and the flu? Because sometimes, you can have a cold that's worse than some flus.
Well,
or feel
different.
Like it.
Yeah, different things will run the different courses, and generally, influenza is a much more severe symptomatology. So you kind of think of, I've got a little bit of cold. Say your adenovirus or rhinovirus. I've got a little cold. Take that tenfold, and that's kind of flu. Now, generally, the other winter viruses that can cause flu-like illnesses typically have more drainage. So flu tends not to create as much runny nose as congestion. Rhinovirus tends to generate, the production of a lot of fluid. So that's one marker. The severe body aches is another one. Flu is famous for the body aches that it gives you. That is another kind of telltale sign of influenza. And last year we even had patients that were testing positive for influenza, and their biggest symptom were body aches. No fever, no cough. So you can kind of run the whole course. Now the question then is, well, how important is it then if you're not really developing the full gamut of symptoms? Do you really have to worry as much? And probably not. You're probably somehow already pre-immunized, whether it's by the vaccine or whether you've seen a virus that's very similar to that one before, and so your immune system has a little bit of cross-reactivity with it. You're probably a little bit protected, and that's why your symptoms are not as bad. So it just depends on the severity of the illness. Now, all people who get the flu can develop the complications from the flu, like the biggest feared complication, I guess, is pneumonia. But with H1N1, you also have to worry about dehydration, because of the flus, H1N1 is really one of the very few that cause gastrointestinal symptoms. The term stomach flu is a misnomer. Most stomach bugs are not influenza, but H1N1 is kind of the exception to that rule. So H1N1, even in adults, can cause gastrointestinal symptoms. It's common in children for flu to cause gastrointestinal symptoms, but not so common in adults.
Are we seeing a lot of that right now?
We've seen some of that. I think more importantly, we've seen the severe body aches, the fever, the chills and rigors, the coughing,
so
congestion.
That seems to be what's going around.
That seems to be the constellation of symptoms that most people are having. Haven't seen as much of the GI component, but we have seen some.
Okay, it's out there. So just, do everything you can. Wash your hands a lot. Try to stay away from people who are sick.
Right.
Get that shot if you feel like the vaccine might be for you. What about small children? I know treating small children is a lot different than an adult, and I know they can often be a lot more dramatic, and sometimes they really are feeling it. So how can you tell if the child really is that sick, or maybe they're just being a kid and they just don't feel good?
Well, children are very good at hiding the severity of their illness. So it can be a perplexing question.
Yeah.
if there's a concern, the best solution is to have them see a physician. You know, if it's a little bit of a dry cough, a little bit of runny nose, they're running and playing and being their normal selves, that's one thing. You know, that's generally, as a broad category, they're generally okay. If they're behaving okay and they're eating and drinking more so than eating, and doing the things that young children do, then you can be a little rest assured. If they start developing lethargy, if they have a decrease in appetite, if they're not drinking fluids, they can quickly become dehydrated if they're running fever. So you know, if any of that is occurring, if they're, you know, it's a good idea to get them looked at.
Yeah, you know they're not feeling well.
Yeah, but I mean, as a group of people, children are very good at hiding the severity of their illness until a breaking point. So you just have to be vigilant, and as not only as parents but as physicians as well.
Yeah. What about grandma and grandpa out there? I know some of our older residents, they're good at hiding it too, or confusing us too. A lot of them will say, well, you know, this is just, my grandma likes to always say, well, Wendy, as you get older, this is just what happens. And some things I want to say, yeah, but grandma, that one's not normal. You should go to a doctor on that one.
Right, you know, it's I guess part of being that greatest generation. They tend to be very stoic. They tend to downplay their own discomforts, and I have quite a few relatives that fall in that same category. So it's kind of difficult to handle your parents or grandparents in the way that you would your child, and kind of trying to coax them to seek help can be difficult. I know from personal experience. However, you know, if you look at the data, 90% of the fatalities in influenza come in people who are 65 and older. So, you know, don't discount that fever. Don't discount that cough. And I think Dr. Walcott had a segment discussing elderly patients before. Not that 65 is elderly, because the older I get, the older elderly becomes. But they're a special group. Our immune system as we age changes, and so we may not develop the classic symptoms with disease that we associate it with in a, say, 25-year-old. So it takes a little extra care. They're not like in pediatrics, where pediatrics can maintain their internal status quo up until very late in a disease course. They can hit that tipping point early on in illness. So it is wise for our older patients to keep in mind that the immune system is not as robust as it once was. Much like our joints start to ache and wear out, our immune system starts to change and is not as responsive as it once was. And actually, that's one reason why they theorize that H1N1 hits younger people more severely, people in their 20s and 30s, because the immune system is so reactive that it generates some of the problems that cause the serious illness in H1N1. But which is why typically with influenza, the deaths are skewed towards young children and the elderly, whereas with H1N1 it was more in people in their 20s and 30s that became more affected. And the thought behind that is because of that robust immune response kind of almost going wild, you know?
Yeah.
But our elderly patients we need to be vigilant with as well, because they can decompensate quickly and be difficult to kind of turn the tide in any illness.
So for those who insist, they know they have the flu and they insist on not going to a doctor, what's the best way to treat it?
Well, flu can be treated with over-the-counter medications. A lot of it has to do with your health status. So whether you have high blood pressure, whether you have diabetes, whether you have other coronary artery disease, there's some medicines that you'll want to avoid. You know, if you're diabetic, you're going to want to avoid any medications that have sugar in them. If you have hypertension or coronary artery disease, you're going to want to avoid any decongestants. Those are medicines that contain pseudoephedrine or phenylephrine because they can elevate the blood pressure. They're cousins to adrenaline. So you know, people who have hypertension particularly are sensitive to those medications, and it can elevate their blood pressure higher than it would otherwise. But if you're generally a healthy person, you know, fluids, rest, Tylenol or Motrin, depending on which one you prefer. Studies show that they work equally as well. I personally prefer ibuprofen. I just like it. Rest, you know, your body's going to need a lot of rest to fight off this type of an illness. So you want to conserve your energy to let your immune system do its job and not push yourself too hard through the flu. Like I said, the flu is a particularly aggressive virus, and you can. It doesn't take much of a toehold for it to get out of hand. So you want to do all that you can. Now you can also use like guaifenesin-based products, although studies don't show that they're very predictable in whether they'll give you relief or not. If anecdotally, if guaifenesin, which is, you know, the main component of Robitussin and Mucinex, if it tends to help you and you know you benefit from it, it's perfectly fine to take. There's a lot of people out there that promote vitamin C, zinc. There's some sound theory as to why that would work. There probably is not. There's not a lot of large prospective studies to look at it. Mostly because there's not money to fund those studies. Because drug companies are not interested in it.
Can it do you any harm by taking extra of those vitamins?
Generally not. Generally not. If you are someone who, you know, has problems, gastrointestinal problems, then too much vitamin C may cause some issues. Zinc may cause some gastrointestinal upset. But generally, those are safe things to take. Vitamin C is a water-soluble vitamin, so any extra gets urinated out. You don't have to worry about loading up on too much of them. That's not true for all vitamins. Some vitamins you can essentially overdose on, but not vitamin C.
What if you get pneumonia?
If you get pneumonia, there are generally two types of pneumonia. There are others, but you can. The biggest thing is going to seek medical help. If you get pneumonia, rapid treatment helps. Depending on the severity of the illness, you may be treated as an outpatient. You may be treated as an inpatient. If it's affecting your oxygenation or other vital signs, there's a good chance that you may be treated as an inpatient. We have antibiotics to cover bacterial pneumonia. You can also get a viral pneumonia. And if you have a viral pneumonia and you're positive for flu, then you will be treated with Tamiflu, odds are. It's very dependent on you and your immune response and how well, and your underlying reserve. So if you have an underlying pulmonary illness like asthma, emphysema, then you have to be very vigilant about how you care for those patients.
Okay, we've got about 2 minutes left. So in these last couple of minutes, I really want to drill home what people can do to protect themselves and their kids. Get
the vaccine, hand washing. If you are sick, quarantine yourself. Stay away from other people. You know, if you're a member of a family and you're the one with the flu, kind of quarantine yourself away from the rest of the family. Have one family member responsible for bringing you food, bringing you water, you know, those kinds of things. Medications, but try to isolate yourself from everybody else. Don't go get on the road and go visit family for the new year, and cover your mouth when you cough or sneeze. You can't overstate that. Clean hard surfaces, doorknobs, bathroom sinks, countertops, kitchen sinks, countertops. It doesn't take a bleach solution for influenza. Lysol is okay. When you use Lysol, spray it and leave it on. You don't wipe it off. It takes that time to kill. So kind of really paying attention to hygiene and the habits in the home can help.
All right, really great tips. Now, for people at home who might still have more questions, is there a phone number or website?
Well, they can always call our clinic. Our phone number is 868-2273. We are here 7 to 7 Monday through Friday and 9 to 5 on Saturdays. The CDC has a wonderful website with lots of patient information that's easy to navigate.
All right, Dr. Bracey, thanks so much for being here. As always, a lot of really great information out there. Hope everybody stays protected from the flu. I know nobody out there wants it this time of year, or really any time of year.
Right.
That's going to do it for us for this Healthline 3. Hope that you have a great day, everybody. Bye-bye.